Hi, everyone. I'm Nicole Wolfer with Providence Newburgh Health Foundation. Welcome to today's Mondays with Mike and Joe. We're so glad you've joined us. We're looking forward to talking about heart health with our special guest, Dr. Leanne Shaw. But before we get started, I wanted to remind everyone that we will have a Q&A at the end of the program. You should see a Q&A button at the bottom of your screen. If you click that, you can type in your questions and we will answer those at the end of the program. Next, I'd like to introduce Doug Kane. He is the Executive Director for the Providence Newburgh Health Foundation. Welcome, Doug.
Good afternoon, everyone. I'm Doug Kane. I'm the Executive Director of the Providence Newburgh Health Foundation. I want to welcome you to our Mondays with Mike and Joe quarterly program. As the Executive Director of the Foundation, our purpose is connecting people to Providence to advance research, patient care, and wellness. We believe passion is at the heart of giving. Mondays with Mike and Joe is a quarterly virtual series focusing on the role the Providence Newburgh Medical Center plays in our community and how caregivers are working to improve health for all who live here. In today's gathering, if you have any questions for Mike and Joe or our guests, down at the bottom of this page, you will see the Q&A feature. Click on that button and you can ask questions. So what do you say we get started? Now I'd like to introduce Mike Donahue, a man who spent over 40 years as news anchor at Coin 6 in Portland. Mike is also a current board member of the Providence Newburgh Health Foundation and has become a great friend. We are grateful for his service to Providence and our community. Please welcome Mike Donahue.
How about that snow in Portland today? Huh? Record-breaking snow. Wow, in April. And nothing here. I guess Newburgh is protected, or maybe we're just missing out on it, depending on your point of view. Well, I'm going to be very interested in what Dr. Shaw has to say today about heart health, because I am a patient with heart disease. I'm joined, as you can see, by my co-host, Joe Yoder. Joe is the Executive Director. He's the CEO, the Chief Executive at Providence Newburgh. Joe, what I see are COVID cases are up statewide with that new covariant, but hospitalizations are down statewide. How are things at our hospital today?
Yeah, thanks for asking, Mike. Things at Newburgh are really well. We've got a full house today as normal, but like you said, COVID hospitalizations continue to remain low. We're hoping that continues to stay the path. We know that hospitalizations are often a lagging indicator of the case count, so we'll watch over the next few weeks to see where things go. But fortunately, by now, our team considers ourselves experts in how to take care of anybody with those symptoms. So we're here for you or anybody in the community if something comes up. You know, I'm thrilled to be here today to talk to our virtual audience about something very important, as Mike mentioned, heart health. With heart disease being the #1 cause of death for men and women in the United States, we're looking forward to hearing a little bit about prevention and treatment today from Dr. Leanne Shaw. Dr. Shaw earned his medical degree from OHSU, completing his internship and residency at the University of Nevada School of Medicine in Reno. Go Wolfpack. He also completed a cardiology fellowship at the University of Texas Health Science Center in San Antonio. Dr. Shaw is currently a cardiologist at Providence Newburgh, where he and his team take a team approach to caring for heart patients. Welcome, Dr. Shaw.
Thanks for joining us today. I feel I must disclose from the outbreak here that you are my cardiologist, so I know you pretty well. In his introduction, Joe said that you take a team approach to patient care in which the patient is actually involved. And I wish you would explain that to us. What do you mean by a team approach?
Well, I think the old way of taking care of patients was the doctor told the patient, here's some medicines, take it. And then that was it. You know, I think now, or at least what I like to see is, you know, when I see a patient, I like to get to know them. but then I want them to do a lot of their own care, take control of their care. So, they need to want to take their own medications, take their medications. It's self-intuitive, but sometimes they don't. Monitor their own blood pressure on a regular basis. Get their labs done when needed. Get out there and do some exercise. Do some preventative care on your own, 30 to 60 minutes every day. But seek help from me to guide them as far as what to do, or how I can help them improve their health, their cardiac health. But in addition to myself, other members on our team we have an advanced provider. So when I'm not around, Brandy Hayes can help them out. There are other advanced providers as well. And then the other members on my team is the nurse practitioners or the nurses and the MAs, as well as the schedulers. They all take an active role in helping the patient or everybody get what they need.
Thank you.
Yeah, good to see you, Dr. Shaw. Thanks for joining. I'm wondering if we could just go over some basics here, and maybe you could start just by explaining to us what is heart disease? How do you define that?
Well, I think when you say heart disease, the majority of people automatically think you have a heart attack or coronary disease. And coronary disease is actually one of the heart diseases, but there are several types. So when you have coronary heart disease, that means the arteries of the heart have narrowed, or you've had a heart attack and done some damage to the heart or minimal damage to the heart. But there are other types of heart disease, including heart failure, arrhythmias, such as atrial fibrillation, atrial flutter, slow heart rates, bradycardia, valvular disease, like aortic stenosis, mitral regurgitation. Those are the two most common ones. Mitral stenosis. Then there's the diseases of the heart muscle, such as cardiomyopathies, where people don't have coronary disease, but have some sort of infiltrative disease that has done damage to their heart, or have had some sort of infection that has done some damage to the heart, like COVID myocarditis, or thickening of the heart muscle due to like hypertrophic cardiomyopathy. And then you have congenital heart disease. Those are where the disease they were born with, some sort of defect, whether it's an ASD, atrial septal defect, or ventricular septal defect, or some abnormality with their valves. So many different types of heart disease out there.
So we think about any one of the different types you just mentioned. How would somebody know if they have heart disease? What are the typical signs and symptoms people should look out for?
Well, again, it all depends upon what the heart disease or entity is affecting them. But some of the common symptoms would be shortness of breath. I think that's likely the most common, or chest pressure, chest tightness. I think we've made a mistake in that people who are having heart attacks, we've been told they've been looking for that heart pain. And a lot of them never have that heart pain where, they have this real bad, sharp, heavy pain. Most of the people who have come in with heart disease or a heart attack actually have more of a chest discomfort, a heaviness, someone sitting on their chest. So it isn't like when you're out when you see it on TV where the guy stands up, clutches his chest. That happens, but that's a rarity. Mostly I'll never forget, I had this guy come in the emergency department. He was a runner. And I said, so tell me about your chest pain. And he looks at me and goes, Doc, I don't have chest pain. I have heaviness. It's tight. It doesn't hurt. It's just tight. I can't take in that deep breath. So that's one of the big ones with heart disease or a heart attack. But other things can include rapid heart rates. So if you have AFib, you can be having a rapid heart rates or atrial flutter, a supraventricular tachycardia. So palpitations, Um, a common thing I found is like a fish flopping in your chest, or a fluttery sensation, a butterfly sensation. Slow heart rates. So if your heart rate's really going slow, passing out is one of the other ones. And then swelling. So you can have swelling in the lower extremities or swelling in your stomach, in your abdomen. Those are probably the most common ones we see.
Quite a few signs of heart disease.
Yeah.
Some people in our virtual audience, Dr. Shah, are probably wondering how they can reduce this risk of heart disease. There's not much we can do about our genetics, but what can we do with these to reduce these risk factors?
Well, I think when you talk about prevention or reduce the likelihood is you think about the risk factors, right? And so what are those risk factors? The most common one being high blood pressure, but other ones are high cholesterol, tobacco use, diabetes, being overweight. And when we talk about being overweight, we talk about a waist circumference. So we found that people who have like women who have a waist circumference of greater than 35 centimeters or inches are at higher risk of diabetes. We found that in men, it's greater than 40 inches. Physical inactivity, poor nutrition, bad sleep patterns, and excessive alcohol. So when you look through that, a lot of those are things that you can make a change in, really not easily, but can eliminate from your lifestyle. So like smoking, quitting smoking, too much drinking, too much alcohol, get rid of too much alcohol. Physical inactivity, start walking. We look for 30 to 60 minutes of exercise a day. Diabetes. Many of the type 2 diabetes is many times brought on by being overweight. Losing weight actually can cause the diabetes to go away or improve. Cholesterol. Many times that's genetic, but we can improve it by exercise and diet modifications. And then, of course, high blood pressure can be treated with medicines, but also we found that secondary causes of high blood pressure, such as obstructive sleep apnea or poor sleep patterns, can improve your blood pressure as well. Exercise can also.
This surprised me. Even with all of the deaths from COVID, heart disease remains the #1 cause of death for men and women in the United States, and that's regardless of race. What are we doing, or what are we not doing that keeps heart disease in first place?
Well, I think because heart disease encompasses so many things, or so many things can lead to heart disease. Like I was mentioning, so diabetes can lead to heart disease. Obesity can lead to heart disease. Tobacco use can lead to heart disease. Kidney disease can eventually lead to heart disease. So there's so many factors out there that are very common in the population. So common things lead to common things. And unfortunately, that leads to cardiac being the most common cause of death. And
it's related to a lot of other things. Yeah.
Yeah. And then many times because of not doing, or the inactivities, the smoking that has continued. During COVID, we found that people were gaining 10 to 20 pounds during those 2 years. I believe I read an article that within the first 6 months of COVID, the average person gained 10 pounds because of inactivity. And we think, well, it's because they're not exercising. Well, yes, but also we're not looking at little activities such as standing when talking to somebody, walking to the next door neighbors, mowing the lawn, going shopping, burn calories. And when we're not doing that, those are incidental calories, but they do burn calories and help you maintain your weight.
Can COVID actually lead to a death by heart disease? Is it one of those?
Yes.
Yeah,
So
well,
COVID can lead to heart attacks. It can lead to inflammation of the heart. It can lead to heart failure. We've all heard about the plaque formation from COVID, Luto syndrome. So you have a hypercoagulable state, or where you form clots during COVID. So COVID could almost be called a risk factor, but it's not one that we can do much about other than get our vaccinated.
Dr. Shaw, if none of the prevention strategies work and somebody does develop heart disease, what treatment options are available here at Newburgh, and how does our program here at Newburgh and the services that you and your team provide tie into those that we have throughout our region and the whole Providence Heart team?
Again, the treatment basically is dependent upon what the final diagnosis is, but most of the treatment, what we can do at Newburgh is the initial workup and the initial and beginnings of the treatment. So we can do a lot of the diagnostic work for coronary disease here, valvular disease, for myocardial disease. So all three of them, so we have the ability to do stress tests here. The stress test can be used to detect coronary disease, but it can also be used to detect arrhythmias. Where we have echocardiography availability here, which is an ultrasound of the heart. It can let us know valvular disease and take a look at the overall heart function. We also have the capabilities of doing something called a transesophageal echocardiogram, which is a specialized ultrasound of the heart in which it goes down the throat and into your stomach, which gives us better visualization of the heart. Usually we do that to rule out a clot, but we also use it to get a better look of the valves in the heart. And we can also perform cardioversions here. So if a person comes in with atrial fibrillation, we can give them an electrical shock. We also have the capability to do diagnostic angiography here. It's where we go into the artery, either the radial artery or the groin, with a tube called a catheter, and advance it up to the heart and inject dye into the arteries and take like an X-ray movie and see how bad their arterial disease is of the heart. And with that, we can do a right heart cath, which we go into the right side of the heart and do hemodynamic checks to tell what the lung pressures are, what the heart function is, how stiff the heart is. So we're able to do that here at Newburgh. Also, if we need to, we can implant loop monitors. So if we hear people or a person has palpitations, rapid heart rates, passing out, we can have them wear 48, 2-week or 30-day monitor, or if we need to, an implantable monitor that will last for 3 years. So we have the capabilities here in Newburgh to do a lot of the preliminary work. And then once we have a diagnosis and once we've determined what's going on, in about 95% of the time, then we can refer them to other specialized areas of Providence, such as the valvular team up at St. Vincent's that helps out, who can perform either surgery or percutaneous replacement of valves, specifically the aortic valve, but they are doing also the mitral valve now. And they're doing clips on the tricuspid and mitral valve. What's neat about St. Vincent's is they have like a committee that takes a look at both options at the same time. So the valve clinic will have a surgeon in there and talk about what options do we have for this patient. Is he too high a risk to undergo open heart surgery to replace a valve? Or is he, or can he do we need to do it percutaneously or through the back artery or groin? But we send them, once we've done the initial work up here, we send them to the specialized centers, heart failure specialists. And here at Newburgh, we do have electrophysiology. So if people have atrial fibrillation or atrial flutter, we can have them see the electrophysiologist to discuss options such as ablation. That type of procedure is done up at St. Vincent's, however. But Newburgh is a great place to get started. And I got to say, for a small hospital, we provide quite a bit of options. And I'm lucky to have two great colleagues who probably know more than me because they've been, they're the younger generation and growing up with the newest developments. I'm getting a little bit older than them, but I have it through experience and they have it through newness.
So if we think about the treatment getting started here at Newburgh and then sort of maybe getting on the other side of treatment, how does cardiac rehab fit into that whole plan? And what does cardiac rehab really entail?
Well, I think cardiac rehab is an important part of recovering from many aspects of cardiac event. So we usually refer people to cardiac rehab after they've been admitted to the hospital with a bout of heart failure, or heart failure, and they've also been found to have a depressed LV function. So the heart function isn't normal. Or if they've had valvular disease or open heart surgery, a heart attack. So what cardiac rehab is, after having these procedures or after having these type of events, we don't want you exercising as vigorously as you may have done previously. We want you to build up to an exercise ability or capacity. And so what cardiac rehab does is perform or help you, the patient, start off that exercise in a supervised fashion and with cardiac monitoring. So we can monitor the heart rates at the same time and blood pressures. So they not only provide supervised activity, but they also provide education about healthy lifestyles, may include a nutritional consult. Some centers may have some mental health help as well. I'm not sure if ours does, especially now since we've just kind of restarted after the COVID. It's kind of, everything's a little bit more limited than it previously was. And then of course, cardiac rehab can also leads us to base camp. We don't have much of a base camp here. The base camp is available up at St. Vincent's, but it is available virtually to everybody here in Newburgh. So they provide wellness recommendations, nutrition recommendations, dietary recommendations, recipes to cook. So it's all income. We get a lot through virtual down here in Newburgh. We have our own center for cardiac rehab, which is really nice.
I'm glad you defined base camp. It sounded like I was about to climb Mount Everest in my care treatment program. Providence has made this statement: we are transforming heart care. So Dr. Shaw, how will cardiac care change in, say, the next 10 years?
Well, I think right now, COVID was kind of a blessing in disguise, I think, sort of, for the care of patients, because during that time, we started doing more outpatient telemedicine, virtual care. And I believe that's going to be the future. From what I can read and see, the emphasis is going to be more trying to take care of patients in their house rather than at home. So they may have a medical condition that 10 years ago, they would have been admitted to the hospital. Now they're being sent home. And in the future, we'll likely have, they're even doing it now. Some physicians go out and take care of patients at their house rather than having them admitted, I think is a great idea because people do better in a environment that they're comfortable with. But I think we're going to see more telehealth, virtual care for healthy and unwell patients as well. They've talked about this. We already know about the Apple Watch and I think it's the Samsung Watch has come out recently, which tell you which is an EKG of your heart rhythm and heart rate. But they also have, I've been hearing about blood pressure monitoring through a wrist monitor too. So that's like coming up soon. I heard about artificial or smart shirts or smart clothing. So all that I would imagine is going to be integrated into the care of a patient as an outpatient, rather than bringing them to the hospital or even to your office to get evaluated.
When we talked earlier, you even mentioned with the advent of artificial intelligence, someday we may have computer doctors analyzing our condition.
Well, I think that's already starting, and I think it's only going to be continuing. I've gone to a couple CMEs where they talked about artificial intelligence, and they were talking about how they could, with the use of a computer, how that computer can help them diagnose by the computer reading an EKG or an echocardiogram, a disease process that hasn't even become evident through patient symptoms. So for instance, I would look at thousands of EKGs and I don't see these small little discrepancies. And look, this EKG looks normal. But artificial intelligence read may look at that EKG, and after reading millions of EKGs and inputting all that data, it looks at it and goes, that little divot there, I've seen in patients who are about to have atrial fibrillation. This patient is and then it will tell me, this patient's at risk of atrial fibrillation, or this patient is at risk of heart disease. Even though the patient has no symptoms, the EKG looks stone cold normal to me, but the artificial intelligence is able to look at those little changes and from its history say, this is probably what's going to happen. And the same thing I've heard about for the echo. I've heard that they're seeing that or the plan is in coronary angiograms saying this defect needs to be fixed, or this defect is fine. You don't need to, it's not that bad. I think artificial intelligence is actually going to, it's out there, and it's going to help us take care of patients a little better.
Well, Dr. Shaw, you should be rest assured that a robot will never replace you. I see we have a line of people in our audience who want to ask some questions. Nicole?
Yes, thank you, Mike. First, I want to say, Dr. Shaw, you got a great shout out in our comments. Someone listening today said that their bovine aortic valve is working great after 6 years. So just wanted to let you know you have some fans out there in the audience. Awesome. The first question, someone wanted to know, what is the best diet for heart health?
Well, cardiology, we always just say the Mediterranean diet, but it's mostly a fruits and vegetable diet with emphasis on fish or chicken and minimal meat. But there are other more nut derived diets. That's actually one of the nice things about Basecamp. They have some virtually you can get some nutritional help with there and what type of diets to follow and recipes there. There's also a book by Dr. Miles Hassel that's great for people who have cardiac disease or want to prevent heart disease or diabetes. I don't know if I'm allowed to say it, but it's called Good Food, Good Medicine, Good Food, Good Medicine, which is a great resource for patients wanting to eat healthy.
Great. And then our last question, someone asked when Heart to Start is going to return to Newburgh, and I was hoping you could give a quick explanation of what Heart to Start is.
So I am not sure when that's going to start again. because I think we've already missed the time point for this year. Usually it starts off in February or March, so that way we can get into one of the 5Ks or marathons. So it's probably not going to happen this year. That what Heart to Start is training program to get you going from a sitting position to either a walking position or a running a 5K over a period of 12 weeks. So it builds you up slowly. We were meeting, I believe it was two or three times per week. And as the weeks progress, your exercise duration improves until you're able to do that 5K nonstop. And it works. I've seen it work in myself. I've never been much of a runner or a jogger, but when I first did it in, I think it was 2014, I went from, I wouldn't say I was sedentary, but I wasn't very active other than work and not being a runner. But I went from that to being able to run a 5K by the end of 12 weeks. And I mean, not run, I mean jog, which for me is like, I always hated running. But the training was excellent, and we were able to do that. And there was many patients who were able to walk that 5K. We had one guy who had both his knees repaired or replaced, and he walked the 5K. He started off not being able to hardly walk, but by the end of the 12 weeks, he had walked the 5K. Awesome guy. He's a patient of mine, and awesome. He was an inspiration to a lot of people. But when we do that Heart to Start, there's a lot of people who become inspirational. You ask, we have people who should be able out here with minimal deficits, but minimal, who should be able to run it and aren't doing it. And then we have people who have bad knees, bad hips, and are out there doing their best and doing it. So it's Heart to Start has been pretty impressive.
Sounds like a great program. Those are all the audience questions we have for today. And Dr. Shaw, I just want to say a big thank you, especially with our technical difficulties. So at this point, I'd like to have you swap out with Doug Kane, our executive director, to wrap us up. Mike, Joe, thank you as always for being our gracious hosts for this program. And we will see you in July for the next Mondays with Mike and Joe. We'll turn it over to Doug.
Hey, thank you everyone for joining us today. As a reminder, our next Mondays with Mike and Joe is scheduled for Monday, July 11th at 12 noon. We will be talking with the folks at the Providence Children's Development Institute here in Newburgh about the special care they provide for children in our community. It will be a great conversation, so be sure to mark your calendars and tune in. We also like to invite you to join our annual Hearts of Gold event this summer. After 3 years, we are excited to welcome our community back to an in-person event. So mark your calendars for Thursday, August 18th for a fun night at Providence Newburgh. We'll be raising funds at the event for our emergency department and honoring two great community members, the Tualatin Fire and Rescue and Amy Wolf. For more information, please visit providencefoundations.org/Newburgh. That's providencefoundations.org/Newburgh. A special thank you to our presenting sponsor of this event, ADEC, for their generous support. And we hope to see you there on Thursday, August 18th. If you would like more information regarding the Providence Newburgh Health Foundation and ways you can support our patients in need, visit our website at providencefoundations.org/Newburgh, providencefoundations.org/Newburgh. You can also call or email me. On the screen is my contact information. Also, if you have any other questions for Mike and Joe, let me know as well. We will be following up on questions not answered during the program via email. Thank you all for joining us, and we look forward to you joining us again on Monday, July 11th.